Dear students, today's topic is for formulating research question. So in our institute, we are having a research methodology workshop. So for that, this topic was allotted. So I have prepared this presentation. So I would like to tell about briefly about formulating research questions. So whenever we start any research program, so what we are investigating something, we want to search the answer for something. So that is shown in the research question. So we'll be having curiosity what is to find out. So that is nothing but research question. So what are the objectives of today's class? What is the research question? What is the process of identification and formulating research question? Types of research variables. What is the criteria for a good research problem? How to formulate the objectives based on research question. So research question, research objectives, and research hypothesis are the interrelated to each other. So we'll see the importance of research question. So what do you mean by research question or research problem? It is a question that researchers wants to answer. It is the first step process, most challenging and difficult phase. Selection of good research problem is discovery itself. So what we are finding, that is very important. When you are searching something, what is to be searched, that is very important, and that will lead to the identification of proper discovery, or that will lead to the that will lead your research on the right track. So it depends upon the knowledge, skill, interest, expertise, motivation, and creativity with respect to the subject of interest. It should be high significance and implication in profession. Something which is not relevant in the today's world. If you are investigating that, that will not stand a important research question. And we have to find out the gap in the knowledge base needed for the professional practice. So identification of the research problem. So in the beginning, we have to search the broad area of the research, and then narrow down to the one sentence statement of the problem and sources of interest of the researcher. Interest of researcher is very important, and it comes from various sources. These are as follows: personal experience, day-to-day experiences will lead some idea. For example, domestic violence. So this is a social aspect to one research where domestic violence is related to alcoholism in husband. Then practical experience, healthcare professionals get plenty of ideas to formulate research problems encountered during the clinical experience. Unrestricted visiting hours and reduction of analgesic demand is a post-surgical ward. That is more important. That we'll find out that the visitors are more than analgesic demand will also be less, because the mind will be busy in some rather than rather than the pain. Then application at the site of heparin injection, there are reduced chances of recurrence. So these observations lead to the what is to be searched in a systematic manner. Then critical appraisal of the literature, pin site infection and external fixator, that is example where external fixators are pinned down. So there is a infection at that site. So if you find that consistently there is a infection at the site, we have to investigate that. Then request for proposals. There are certain agencies, for example, there are certain institutions which give research funds. So they will describe the problems that need addressing. That also will prompt us what topic is to be taken. So previous research, previous studies highlight the limitations in their studies. So these limitations, we have to find out whether these limitations can be curtailed and we can take up the study, new studies, prompt us to have suggestions to take up the new study. Then further refinements we have to take up based on the previous studies. So previous research will also guide what is to be research problem. Then identification of research problem, various existing theories we have to see. Then consumer feedback in case of commercial research, performance improvement activities. Then social issues we have to take into consideration. Brainstorming, we have to discuss with your peer or senior or your colleagues, and we have to go for the formulating the research question. Then intuition, sometimes in over a period of time, in the years together, the research practice, this practice of clinical practice will lead to certain findings which will intuitively think that this is the reason of that. So there is a need of investigating. In that research question, we can formulate from the intuition. And folklores. Folklores are so helpful. Application of the oil for the infant. That is a practice in our rural area. So such things we can investigate systematically. The exposure to the field situations. We have to well, whenever we are doing the field work, exposure to the field situation will lead to the new experiences. In that case, we can investigate if there is a certain considerable finding. Then consultation with experts, you have to discuss with your seniors, and accordingly you have to go for the identification of the research problem. Then what is the criteria for the good research problem? FINER, that is acronym. So what is the full form of FINER? It is a feasible, it should be interesting, it should be novel, it should be ethical, and it should be relevant. So it should be original, interesting, and current. It is a feasible in the time, cost, equipment, and administrative support should also be there. Peer support should also be there. Availability of the subjects, researchers' competence is also very important. Ethical considerations. So these are the various aspects we have to see whenever we are selecting the research problem. So feasible, interesting, novel, ethical, relevant. These are the FINER criteria. So whenever you are formulating a good research problem or research question, we have to test all these 5 criteria, and then we have to select it. Steps in formulating research question. So first one is a review of state of art information. We have to go for review of literature, find the gap, then raise the question, then decide whether that question is worth investigating by peer review, define the measurable exposures and outcomes, then sharpen the initial question and refine the question by specifying details. Then now here is the example what the previous flowchart was shown. So here I want to study the exercise and diabetic control. So now it is well-known fact that exercise leads to the diabetic control because of reduction of fat or reduction of the this. So first question will be, should diabetics do exercise daily? So start conceiving research question. So this is one first question, that is the beginning. Now here another question we can ask, can exercise help control blood sugar level? It is rather vague and it should be defined. Now we have to, so cause and effect. Now we have to see what is the cause here. Cause is the exercise and effect is the diabetic control, blood sugar level control. So it should be properly designed. So first decide worth investigating by peer review. So we have to ask our seniors or our teachers. So what blood sugar level you would like to measure? For example, whether you would like to do the average blood sugar, or whether you would like to investigate the postprandial blood sugar. So that is another refinement. And second is exercise. Which exercise, whether it is a cycling or walking or jogging. So these exercise we have to do. The duration of exercise. What is the duration of exercise? That also we have to decide. So then define measurable exposure and outcome. So we have to define. So exposure is walking. Outcome is control of the blood sugar level. Then sharpen the initial question. So initial questions will be, first question, which is rather crude or just primitive, should diabetic do exercise daily? Then second question was, can exercise help control blood sugar level? Now we have to sharpen the initial question and refine the question by specifying the details. Now here, final research question you can see, in order to improve management of type 2 diabetes. Here diabetes is also defined. Type 2 diabetes mellitus. We wish to know whether brisk walking by diabetics at least 1 hour daily reducing fasting blood sugar as compared to those who are not. So this is the comparative study, or this is the analytical study. So analytical study, 2 components are there and we want to compare. So in order to improve management of type 2 diabetes, we wish to know whether brisk walking by diabetic at least 1 hour daily reducing fasting blood sugar as compared to those who are not. Then this is another one. Second one is, what is the extent of walking practiced by diabetics, type 2 diabetics regularly. So this is the descriptive study. Just we are not going any intervention. We are not doing any intervention. We are just observing it. Descriptive study. So there is no intervention. It is not an analytical study. So these 2 research questions are, so depending upon the topic is same, but depending upon what question we ask, the study study type is also different. So what is the process? First is the selection of research area. Here you can see the example. Study the first initially the researcher selects a broad research area, hospital acquired infections. So in hospital acquired infection, there are so many aspects. It may be ventilator associated pneumonia, or it may be catheter associated urinary tract infection, surgical site infection. So different topics are there. Again, different organisms, Pseudomonas, Klebsiella, or drug resistance in hospital acquired infection or fungal infection. Now the researcher do the review of literature and theories, and amongst that he reads the literature and he decides that candida in hospital acquired infection, especially in the catheterized individuals, it is worth investigating. So he reads the literature and finds out what is done already. Extensive review of literature and review is done at this stage. See the gap in the research topic which is yet to be addressed in above broad area of hospital acquired infection. Then we have to delimit. Next, the researcher will delimit the research topic. At this stage, the researchers find that candida infection under hospital acquired infection yet needs to be explored as he selects candidial infections. So candidial infections also in which population? In catheterized population. So this is the delimitation of the research topic. So which system should be studied? So here evaluating the research problem. Here select the nosocomial infections of candida in 40 patients. So he selects last, in the end he selects the nosocomial infections of candida in catheter associated urinary tract infections. So now based on this formulating the research problem. Now now ultimately he comes to the uh, title that a descriptive study on incidence of nosocomial candida infections among catheterized patients admitted in ICU at tertiary care hospital in North Karnataka. So this is the topic ultimately after doing so much here. So descriptive study of incidence of nosocomial candida infections among catheterized patients admitted in ICU at tertiary care hospital in North Karnataka. Now we have to ask various questions. The substantiality issues are also there. Does the problem have significance in healthcare profession? Yes, it is very important. Nowadays, healthcare associated infection. Does the problem spell out purpose of conducting study? Yes. Incidence of candida. Does the problem have existing theories and models? Yes. The problem is having existing theories and models. Previous studies are there. Then does the prior specific knowledge and information utilize? Yes, it is utilized. Then a few other questions are also there. Methodological or ethical practices. Does the problem statement clearly identify research variable? Yes. Incidence incidence of candida in 40 patient. Does the problem identify nature of population? Yes. Which population? Catheterized individuals in ICU. Then which are giving the growth of candida in 40 patients. Does the problem clearly define the type and design of study? Yes, it is there. Descriptive study. So type of study is also there. Design of study. Descriptive cross-sectional study you can tell. Does the problem have research setting, place and time? Yes. Research setting is ICU patients. Then place tertiary care and time. Time is not mentioned here. Does the problem comprise appropriate phrases? Yes. Then another important ethical aspects are also there. Whether the human subjects are here in this investigation, in this research, yes. Does the problem imply potential factors risk for the subjects? No, because just we are not doing any interference or we are not doing analytical studies. Does the researcher appropriately delimited scope of the problem? Yes, appropriately delimited because he has taken restricted to the candida in 40 patients. So there is no invasive investigations on the patient or there is no any interference. So now how to state the research problem? So there are two formats. One is a declarative format. Declarative format, example, descriptive study on incidence of nosocomial candida infections amongst catheterized patients admitted in ICU at tertiary care hospital in North Karnataka. So this is the declaration statement form. And then another one is the interrogative form. Interrogative form means question is asked. What is the incidence of nosocomial candida infections among catheterized patients admitted in ICU at tertiary care hospital in North Karnataka? So this is in the form of question or something we are asking. So that is the interrogative format. So now come to the components of research problem. What are the components? So in this study, you can see study design should be there. Study design is there or not? Yes, descriptive study. Variable, what is the variable we are using? Incidence. Then population. Population, what population we are using? Catheterized patients admitted in ICU. Catheterized patients admitted in ICU. The research settings we are taking, yes, tertiary care hospital. So in ICU, tertiary care hospitals they are taking. So that is the usually it should be clear. These components should be there in the research question. Then what are the variables? Variable, what do you mean by variables? Variables are qualities, properties, characteristics, situations. And there are two types of variables, independent variables and dependent variables. At the name, the term itself indicates. Now here example just for explanation of independent and dependent variable. So here one study, experimental study on effect of 4-hourly mouthwash. 4-hourly mouthwash on prevention of ventilator associated pneumonia among patients admitted in ICUs of ESIC Medical College, Kalburgi. So here you can see which is a dependent variable and which is independent variable. So here you can see dependent variable is ventilator associated pneumonia. Why it is dependent variable? Because it depends on how the bundle care is taken. So 4-hourly mouthwash. And which is independent variable? 4-hourly mouthwash is a independent variable. So 4-hourly mouthwash independent because we can modify it. We can do 5-hourly, 6-hourly mouthwash also. But ventilator associated pneumonia, it is depending upon the bundle care what we are taking of that patient. So ventilator associated pneumonia is a dependent variable and 4-hourly mouthwash is an independent variable. So various this uh, the case control study, analytical study, experimental study, they are having variables. So what are the examples of dependent and independent variables are there? What are the examples? In these three types of studies, case control study, analytical study, and experimental study, there are dependent and independent variables. Whereas descriptive study, exploratory study, comparative study, qualitative study, so they are measured in the natural settings. They are measured in natural settings without any intervention, and there is a no cause and effect is measured. So only qualities or attributes or properties or characteristics observed in natural settings. So these are observed in natural settings without manipulating. So therefore, there are the no variables. So example is given here, descriptive study on incidence of nosocomial candida infections among catheterized patients admitted in ICU at tertiary care hospital in North Karnataka. So here, this is the study which is a descriptive study. So therefore, there are no need of any research variables. So other types of variables are also here mentioned, demographic variables, extraneous variables, based on variables involved in study. The studies are classified as univariate, only one variable is there, bivariate, two variables are there, multivariate means multiple variables are there. So these are depending upon the presence of variables, the different studies are there. So now research hypothesis. What do you mean by research hypothesis? It is used for analytical studies. So whenever we are doing analysis, so something is there in the mind. So research question, that is the statement, hypothesis is the statement, what is the prediction of this study. So that is called as research hypothesis. So research questions, what is the difference between research question and research hypothesis? Research question is the inquisitive in nature, whereas hypothesis is a predictive in nature. So we are predicting it. So in the beginning, we are seeing diabetic control and walking or exercise, regular exercise in type 2 diabetic individuals. So regular exercise in type 2 diabetic individuals will reduce this much blood sugar level. So that is a hypothesis. Research question: does the exercise of 60 minutes daily decrease the blood sugar level? So that is a research question. Research hypothesis is the statement. The research question can be used if there is a little previous research on the subject. So that is the, if there is no evidence of previous research, you can use the research question. Hypothesis can be used if there is a significant knowledge or previous research on this topic, on this subject. So now come to the next, almost we are coming to the end of this presentation, means last point, writing the research objective. It should be clear, concise, declarative statement which provides direction to the investigate the variables. It should be related to the statement of research question. So you can see research question, research variable, and research question, research hypothesis, and objectives. They are interrelated to each other. And it should be smart. That is, it should be specific, measurable, attainable, realistic, and time bound. So this should be smart. Objective should be smart. It should give glimpse of what is to be achieved in the study. It should give glimpse of what is to be achieved in the study. Objectives should include obtaining answers to the research questions or testing of research hypothesis. So objectives should give answers. So what answer will give? So that is to be related to research questions or research hypothesis. So what is the need of objectives? Objective give focus to the study. It avoids the vagueness in our study, organizes our study, and give the direction to the study. So this is the importance of objective. So types of objective: primary objectives and secondary objectives. So method of stating objectives: it should be brief and concise. It should cover different aspects of the problem, clearly framed in operational terms. So what are those operational terms? I will show you in the next slide. The realistic, considering local condition, use action verbs specific enough to be evaluated. Action verbs should be properly utilized here, properly used. You can see the various action verbs. So you can see knowledge, comprehension, application, analysis, and synthesis. Knowledge, you can see count, define, describe, draw, identify, label, so on, etc. etc. Comprehension: associate, compute, convert, etc. Application: apply, add, calculate, change, classify, complete. All these are the related to application. Then analysis: analyze, break down, design, detect, differentiate, discriminate. So these are the analysis level. Then synthesis level: categorize, compose, create, design, revise, integrate, modify, organize, plan, prescribe. Then next is appraise, assess, compare, conclude, contrast, criticize, determine. So these are the different action verbs we should use appropriately whenever we are formulating the objectives. So now take home message is formulating research question. Read the literature. We have to read the literature properly. Observe, or otherwise the person who is already working, faculty or SR, observe day-to-day practice, and in the day-to-day practice, if he finds something new or interesting while doing work, observe in day-to-day practice. Then in the literature review, there are the research, the gaps, justify the need of study, discuss with the peer groups and senior or teachers. And another thing is introspect, whether this particular study is harmful or whether it is irrelevant. Irrelevant means it is a waste. It may not be harmful, but irrelevant means it is a wastage of your energy. So that is your take-home message, and then you devise the research question properly, research hypothesis, So you can see research question, research hypothesis, and objectives. They go hand in hand. So it should be interrelated. Otherwise, the study will not be proper. Thank you for your patient listening.